To Simon Ateba from Today News Africa. Simon, please unmute yourself.
Thank you for taking my question. This is Simon Ateba with Today News Africa in Washington, D.C. And thank you for doing this longest press briefing series for more than a year now. Yesterday, the WHO Africa Department said Africa needs at least 20 million doses of AstraZeneca vaccine in the next 6 weeks to get second doses to all those who receive a first dose within the 8 to 12-week interval as recommended by the WHO. We know that President Biden is sending 80 million doses to COVAX by the end of June, beginning of July, and that the EU member states have pledged to share 100 million doses with COVAX. I was just wondering if you could detail how pressing is the vaccination situation in Africa, and how many of those doses would you like to see go to African nations? Or even, what is the WHO doing now to ensure that Africa is not left behind and that those who need a second dose have it? Thank you.
Thank you very much. I'll guess maybe we start with Dr. Bruce Aylward, who joined us, who's, of course, the Special Advisor to the Director General, the lead on the ACT Accelerator. Bruce, go ahead.
Thank you very much, Simon, for the important question about what's happening with respect to the vaccine rollout in Africa. As Simon referred to yesterday, the regional director for Africa held an urgent press conference to highlight the issue that Simon's referring to, and that is the fact that Africa has vaccines sufficient for less than 1% of the population of the continent, striking disparity when you look at the situation in any other region of the world, in fact. So indeed, Simon, this is one of the areas of greatest attention and greatest urgency, and hence the reason for that press conference yesterday. Simon, they did refer to the need for 20 million doses to serve as second doses to the AstraZeneca doses already given. But the regional director went further, and she emphasized that we need 200 million doses, and that is sufficient doses for nearly 100 million people on the continent to stay on track with the goal of getting at least 10% of that population vaccinated on the subcontinent by the end of September, en route to at least 30% by the end of this year, as is the goal right now, just through COVAX alone. That's not even counting doses that would come through other arrangements, such as that being made by the African Union. So there is indeed a huge amount of work ongoing with countries that have doses. I don't want to say surplus doses, but that do have doses and have already vaccinated their high-risk populations, their healthcare workers, and are in a position, we believe, to begin sharing doses with areas such as Africa in particular, and most urgently. So I can assure you, Simon, that is one of the top priorities, and not the top priority in terms of additional doses. But at the same time, you will have seen the situation in Southeast Asia, where we've had escalating outbreaks in countries surrounding India in particular, with a desperate need for their second doses as well. So the need is indeed on the continent, but also in various parts of other parts of the world as well. In terms of donations, indeed, we're in close contact with the United States, with the European Union member states and other countries about now trying to move as quickly as possible on the commitments and of donations that they've made. And you'll remember, we talked about this last week, we're going to need the support not just of the countries that are donating the vaccines, but also the companies who actually they have contracts with, because that's a really important part of the solution. And we were pleased to see over the last couple of weeks some strong commitments from manufacturing associations and manufacturers to try and do everything possible to ensure that donations can be actioned within days of countries that want to share them. And then the third part of the equation, of course, is working with COVAX, and then, of course, with the countries receiving the doses to make sure that they go to use as rapidly as possible. So a huge priority, Simon, trying to get those doses in place. We need many more doses than 20 million. That's just to get the second doses into the very, very few people who've been vaccinated so far. We need hundreds of millions of doses to start moving toward vaccine equity and to start getting not just the high-income, well-vaccinated areas out of this pandemic, but the entire world. Because as the Director General said so many times, we can't get out of this alone. We need to get out of this together.